Hi all, I'm so sorry. I think we just lost connectivity there. I hope most of you are still watching. Um, Simran, if you can check on another device if I'm still visible. I think internet is not being too kind to us today, but I think there's always a first. So I've been live so many times, but I've never experienced this kind of a sudden disconnect. So I'm so sorry about that. But going back to where we were left off, and I think more of you will join in. Hi Khushbu, hi Resham, and so sorry guys. I hope most of you are back and watching. Today I'm at the clinic, and yes, right in between sessions of work, I've just gotten rid of my PPE. As you guys can see, I still have my mask marks. So hi Renu, so good to see you guys back, and sorry about that little interruption. So we were talking about patient communication. Hi Suresh. And for most of you who are dentists, of course, communication could be a bit challenging right now. And for those of you who are patients, you all can relate to what your dentists are going through at the moment. Hi Bhairavi, hi Simran, hi Suresh. So as more of you join in, the particular challenges that I was talking about when it comes to communication in these times is that the first and most important thing, I think, has been that all forms of communication has been remote, right? And we are specifically talking about our remote patient communication because at this point, patients are the people who we interact with the most, and we miss them the most. So I wonder if our patients feel the same as well. Now, I wanted to ask all of you, have you faced any problems interacting and communicating with people? And how do you cope with those challenges? Because I think communication is absolutely key to everything we do, right? I mean, not just if you're a dentist, but in fact, if you're in any walk of life, if we don't get that first bit of communication right, don't you think everything from there falls apart? So hi Manoj, hi Bhairavi, hi Gaurav. So if you guys have faced any particular challenges with communication or even interacting with your patients, then do tell us. And if you as a patient feel like your doctor or your care provider can improve their communication in any way, then please write away, because we always want to know what our patients are thinking. So our live today is basically purely to get us all thinking on the best ways of communication. And I'm going to address 7 stages or 7 challenges that we talk about. I like my lives to be educational in some way, because now that's the only way we sort of learn and brainstorm with each other, right? Hi Swapnali, hi Dr. Brajesh, hi Preeti. So I think more of us are joining in. Wednesday afternoon, I guess a lot of you will be watching it later as well. And yeah, it looks quite cloudy today. Oops, you can see my ring light in the background. Otherwise, it's pretty dark in here. So yeah, I've found a nice cute corner today at the clinic, which I can sit and talk to you all from. Because as we're getting back to work, I'm probably not going to have the luxury of being home too often to see you all and talk to you all. So keep it engaging and keep asking, guys, if you have any questions. And I'm going to start talking about the very first stage that we talk about when we interact with patients. And that brings me to the first one, which is awareness. And I think it's really important that as doctors or as patients, we should know that we have to be aware of the fact that today, meeting your dental care providers or even your medical care providers is not something that you should put off anymore. It's something that you should be going back to as a normal. Hi, Dr. Arvind Shetty, I hope that's who it is. So hi, nice to see you. And hi, Arun, good to see you. I think I've met and known these people in different capacities over the years, but so nice to have you guys watching, and feel free to post, comment, all of that. Hi, Hector. So we were talking about awareness, and I think the key to for all of us today is to not live with fear anymore, and to ensure that we are going back to work, or even looking after our health, not putting off our needs anymore, ensuring that we're all aware that it is now safe to come back to work. And as much as we have been talking about precautions and safety, it's also important that we get responsible about how we come back to the dentist or any other healthcare provider. So just building this awareness with our patient base is something that we must learn to do. So if we were not really communicating with our patients so far, it's time that we do. And we personally have started doing a Facebook group for our patients where we are interacting with them. We are creating that small tidbits of awareness and information which helps them realize that, the myths that are surrounding today's pandemic are probably just that. They're just myths, and learning and educating yourself about the facts is really essential. Hi, Dr. Sahin. Good to see you. And so as we talk about these stages, I think awareness is the first and the very first stage that we need to focus on. Are all our patients aware of the fact that they are absolutely safe to come in? If we've achieved that goal, then we've really got the awareness out there. And awareness is not merely talking about safety, it's also knowing what are the protocols when they're coming back to work. I think that's equally important. And I'm still answering phone calls that ask me, Doctor, are you back at work? Of course I'm back at work. It's been many months, and we can't afford to not provide care. When we took that oath, we decided and promised to be there for you as much as we humanly can. So we are back to work. I do respect and understand people who haven't gone back to work yet for the safety of themselves or their dependents. But we have to be able to tell our patients whether we're back at work or not. We shouldn't be getting calls at this stage which asking us whether we're back or not. And the mode of communication that you choose to create this awareness is completely up to you. It could be social media, it could be a telephone call to all your patients, it could be snail mail to all your patients, but of course hardly anyone's going to use that mode right now. But the point I'm trying to make is that let your patient family really know and understand that you are here to look after them, and that's the awareness that we should be building. After this comes, I think, the second stage, which is where patients start asking us or inquiring with us that are we open, is it safe to come back or not. And this inquiry stage is basically initiated by the patient. The awareness is initiated by us, where we go ahead and let our patients know. The inquiry would usually come in when a patient has pain, when the patient has some sort of discomfort. That's when they'll end up coming in and asking. But at this stage also, how we handle the patient inquiry is really important. One of the challenges that I would face is, if you have many patients wanting to come in at the same day and same time, how do you filter out which patient when? Because we have realized that after being shut for a while, or many practices still not being open, there is definitely an overload in the dental industry. And we are seeing many people coming back after months of not being able to get care. And for this main reason, we need to understand that we will have to triage or filter our patients. So triage is a popular thing that happens in all hospitals, where you segregate patients based on their importance or priority or emergency, which means if someone has pain or an emergency, then they are probably going to be called in first, and someone who has just minor discomfort comes in second. And then comes the last stage, where someone is maybe coming in for something aesthetic or just a maintenance based procedure. So hi Harsha, hi Kausar, and thank you Bhairavi. Bhairavi saying it's a very informative session. Hi Yogesh. So as we see more and more people join in, I want you guys to comment about what has your experience been in this pandemic, communicating with your clients or patients. And we were talking about how we end up triaging our patients and seeing them on the basis of their priority. If they've been suffering for really long, they'll probably get an appointment first. Now, we are seeing a surprising understanding from our patients, because when we opened, we assumed like, how are we going to communicate this challenge to all our patients? It's going to be seriously hard to tell somebody that we don't have an appointment today because, there are 5 more people before you who have a lot of dental pain and we need to see them before we can accommodate you. But people are being genuinely understanding about the fact that there was a dearth, and now we can only look after so many people at a time. The other thing we are seeing is that our work is slower now, a little bit slower, because we are keeping mandatory intervals between patients wherever possible. We are redraping our surfaces, cleaning our surfaces, which is taking us much longer. So when earlier we would be seeing maybe say 10, 20, 30 cases, at this point we are only seeing maybe 5 to 8 cases a day, maybe some days 10 cases now after all this while. So patients are understanding of that fact as well, because it's a question of how we end up communicating this message to our patients. So I think whether it's me or it's all of us, we need to start talking to our patients in a way where they understand the back end, or they understand the situation that we have found ourselves in. And I think we're all united in this pandemic. So I am yet to find somebody who is not empathetic or not understanding about everything that we've been through. So hi Keshav, nice to see you. So I'm seeing many people joining in now, and lots of questions, comments are welcome. Whatever you feel like you are dealing with in terms of a challenge when it comes to communication or interacting with your patients or clients, do let us know. We have just spoken about 2 stages. One is awareness and the second is patient inquiry. If you'd like to know more about these stages in detail, then of course you have my little book here. It's not little, it's 200 plus pages on everything to do with coping with the pandemic. So that brings us to the 3rd stage, which is, I think, the actual appointment booking. So after we've communicated well, we've created that awareness with our patients that it's safe to come in, how do we really book in our appointments? Are we booking in multiple appointments? Are we just allowing people to walk in? Is that happening? Preeti is asking, how do you triage the patients? Do you do a video consult? Yeah, of course. I think you've been in one of our video consults, so I'm glad you brought that up, because how we do it is basically without seeing the patient. If we are going to triage them, it's only by taking a detailed history. We have been actually, doing video calls, and I have seen people put in their phones in their mouth as well. It's because we have to see what the patient's problem is, and we want to be completely prepared when the patient walks in, because we want to reduce their sittings as far as possible. Having said that, of course, some cases will require, multiple sessions, but we want to make our treatments more efficient and effective. So a video consult we've seen is really changing the way we've been practicing, because we have already met the patient. So we've already, warmed up to each other. They have, spoken to their heart's content in terms of their problem. So it's already establishing a really good communication between us. And that's why when the patient comes in, they really appreciate the service, because we're already ready for their specific problem. No time is wasted. We straight get to the point, because all discussions have already been dealt with. Even their formalities, their COVID consents, their history, all of that, even their treatment plan, everything's been discussed. So the patient comes in a lot less scared now, and they come in with a full plan and probably a much shorter visit. So that's why the importance of actually doing a video consult, and that's how we've been building it up with our patients, even though we haven't seen them for so long. And there are people we're meeting for the first time, and they've probably never seen us before, right? With our masks, and we are barely recognizable. In fact, I don't recognize people in my own clinic, where everyone's just from top to bottom covered. So when we meet them on a video consult, they see us like you're seeing me right now, and it definitely brings back that old sense of human touch, human interaction, which is so important at this point. Life cannot be lived behind a mask all along. We've been so used to the smile, we've been so used to expressions to communicate our feelings. So all of that still happens on video with us. So that's how it goes. And so that's why appointment booking and triage is so important. So our appointments will be booked with a telecall or a video call first, and then we go into an actual appointment sitting, and we will usually do a pre-booking, which means the patient will give us all their details, all their forms, their paperwork, their medical history, everything before. And I think if you guys have seen our live with Dr. Adarsh, you may have seen the contactless patient appointment booking. We are inspired by that, so we try and follow that as well. And yeah, so finally when the appointment booking is done, there is another stage that happens at this stage. And I think and this is something I've developed even after writing the book. And this stage came from one of my recent experiences. It's very important that we allow our patients to opt in to treatment, because we'd be surprised to know that maybe some of our patients just want to come in and do emergency treatments. But if you're not communicating well at this stage, we may start doing multiple treatments for them, assuming that they are comfortable with that, but they may not be, because they may have someone dependent at home, they may not be comfortable at work. And although earlier we had that communication happening in the clinic itself, but now because of a lack of time and because of multiple restrictions in terms of our PPE, patients are unable to communicate with us on the chair. And that's why it's important to avoid misunderstandings and ensure that we are allowing the patient to opt in for the next phase of treatment. So how we do it now is that we end up doing their main complaint, and then we go on and do anything else for them. If they want to get their whole treatment done now or later, is a choice that they are given. So I think for all the practitioners out there, please give your patients this choice. Don't assume, like we may have earlier in the past, that patients want to get everything done. So a patient opt-in at this point is really important. Hi Nazat, hi Nikhil, hi Vicky, hi Tuli. Nice to see you. I'm seeing a lot of people watching. Let your comments flow as well. Please feel free to ask us any questions regarding communication or patient interaction. That's our topic for today. And as I was saying, if we actually go through the entire treatment with our patients, it will make their choices based on the current situation very informed, and it will prevent any kind of misunderstanding. So if we can actually do this, it'll help us. It'll help us make that interaction very smooth, very warm, and very sort of interactive, even if there's very little words spoken in that, right? But if we have forms, if we have write-ups given to our patients, it will help clarify many doubts for them. And I think most of our patients who are scared, it's because of a lack of knowledge. Most of our patients who react badly with us, or who may get offended by little things, it's only because of a lack of communication. It's only because somewhere we've gone wrong in that interaction or that journey with them. So what do you guys think has been the most challenging communication difficulty that you've come across? Maybe it's at work. Do comment and tell us. And as I was going on with the stages of patient interaction, there are two more stages that we want to talk about, and I am going to refer to my book, as these two new stages that I added were as a result of going back to practice. That's when I realized that yes, there are already additions to the book which I should be making. Already time for a second edition, I guess. And the patient interaction model that I was talking to you guys about was right here, if you can see. So yeah, I don't know if you got a glimpse of that, but so if we are talking about a new patient journey, that's something that we need to communicate to everyone, because when a patient walks in, they are a bit scared or a bit taken aback by what exactly has happened, how different is this dental experience, and for this, I would want to say there's a simple example of a child. So, you know how the video consults have been helping us work with children is that they have already seen us in our PPEs, so they're not so scared anymore. And if we can actually do this and, not create new fears in their mind, I mean, how unfair is it that they're living in this reality of masks and fear and COVID and the virus? If we can take away a little bit of that pain and a little bit of that fear, that'll be a job well done. And how we do it is we show them this new patient journey. We show ourselves to them on video. We, give them this little theme that we're playing, which is that we are on a mission to Mars and we are astronauts. And they really find it entertaining when we do this. And when they come in, they're not so scared anymore. They open up their mouth and they are allowing us to treat them. So, Preeti is asking me a question. To tell the patient that we don't have open appointments for the day has been a challenge. I completely agree. But as I was saying, I think what we should be telling our patients is to rationalize with them that yes, we are taking things slower than before. We want to ensure your safety. We want to make sure that we're following all protocols, which takes a little bit more time. And, as long as we can keep our patients comfortable through this time, I'm sure most of them will be empathetic and understanding to the fact that there's only so much capacity at every dental practice. And I would not say don't look after them or don't tend to their problem immediately. You can do that with a teleconsult, a phone consult. And what I'm noticing is that from before to now, I'm actually meeting a lot more patients. Some may be in the digital format, some may be on the dental chair. So it doesn't matter how, but I'm seeing many, many more patients, solving many more queries. So why not? It's just about thinking out of the box, and I'm sure the patient just wants their problem dealt with. They are not insisting to come in on the same day itself, knowing that yes, there will be some challenges. So I think if we are open and honest about this communication, most people are responding pretty well to it. So that brings us to, I think, the last stage of this communication, which is after the appointment. And I am referring to my own book because there's so much that's been happening and changing as we go that I wouldn't want to confuse you guys. I would want you to follow these steps as we spoke about. And the last stage is really the communication that happens after the appointment. And why is this so important? Because earlier we would say the appointment ends and the patient would call back when they wanted to, right? But the fact of the matter now is that we must follow up and look after our patients well after their appointments are done for multiple reasons. One, we want to make sure that they're doing okay, whether the dental work that we did for them was up to the mark. Are they still experiencing some symptoms? Maybe they don't know how to reach us. Maybe they have some queries. Maybe they have some residual issues that they want to, have dealt with. So, you may want to touch base with them again. It's a personal touch. It's a human connection. At the same time, it communicates a spirit of care and concern that we as practitioners must have. And another important reason could be that if your patient tends to get detected with the disease after, then you want to keep a track of that, because you have been exposed to those patients as well. Despite all your precautions, if you have been exposed to somebody who has contracted the virus, then it becomes your moral duty to isolate yourself and your practice, pretty much whoever has come in contact with those patients. So this is another reason why follow-ups are extremely important for all our patients. And that really completes our patient communication journey. So right from awareness to inquiring, to dealing with patient inquiries, to communicating and triaging patients, to actually communicating what is this new patient journey, how have things changed, allowing our patients to opt in for treatments, discussing their treatment plans at length, and finally ending with communication ongoing after the appointment as well. I think those are some of the important stages of interacting with our patients in this new world. And I know the challenges will continue to mount. Every day there's something new happening, but we have to prepare ourselves even more, and we have to ensure that it's through these little things that we do for each other that we can fight this feeling of being isolated from each other. I really miss the times where I used to have a cup of coffee with my patients, or just spend the day doing a smile design. I can't do those things any longer, or as often, or not in the same way, at least, because we are still bound by time. We are still bound by not taking off our masks or our PPEs and all of that with our patients. But I think there will be a time soon where we can go back to a lot more human interaction. And I think there are pros and cons. We are talking to people on video so much more. So I think for every crisis, there will always be, as they say, a silver lining at the end of every gray cloud. So if we can focus on the silver lining, I think we have a good, bright future ahead of us. So do write to me if you still find any challenges when it comes to communication. I'd love to answer those questions for you. Thank you so much for watching, and do let us know if you have a topic in mind for our next live as well. Tomorrow I will be coaching teams on the same topic, and this is part of my dental assistant training program. And tomorrow we talk about patient communication with teams from all over India. And this is part of our series of mentoring, which is tomorrow is session 2 of our mentoring, session 2 of the new program, but session 5 of the overall program. So if any of you are interested in getting your teams trained with us, then do let us know in the comments below, because communication doesn't just end with us. It actually begins with our team. The person who picks up the phone, the person who welcomes your patient into the practice. I think those things are so very important to ensuring that what you have in mind, the things you've learned, is exactly what your patients are experiencing as well. It's a challenge every day. I understand it's not easy to change your systems overnight, but the important thing is to keep gaining knowledge, keep training together, keep working on it together, and I think we can create better healthcare for patients in this new world. So good luck to everybody. Have a great evening, and I'll see you very soon again.